I'm McKenna, and I'm going to be doing my IV push medication administration and then my piggyback administration. I have Cassie filming, so she's going to scan the room. Okay, and then this is going to be my med room, my patient room. I have my provider orders and my MAR. So I'm going to start off in the med room. I'm going to do my hand hygiene, and I'm going to get on a clean set of gloves. I'm going to look at my MAR here, and I have Shirley Cost. She's 54 years old. Her date of birth is 5/14, it's 1964. She's in room 211, and she's going to be getting some morphine, 5 milligrams IV push for pain, PRN, and then she also has normal saline, 250 ml bag, running at 75 mils an hour that we're going to get going for her, and then she also has ceftriaxone 1 gram for IV administration in a 50 ml bag, and that is going to be running over 60 minutes. She's on bed rest with bathroom privileges, and her diet is regular as tolerated. So the first thing we're going to do is just get her morphine ready to go. So I'm just going to go ahead, and I have my syringe here and my needle. My syringe would come in a package usually, but I'm reusing it for video purposes. Normal saline, and then my medication, which I'm reconstituting with the normal saline, so I'm just going to double check my order here. I'm going to look at my medication. This is a 10 milligram per mil vial, so we're going to drop half a mil, making sure there's no discoloration. We're going to take the cap off. Same with the sterile water, no discoloration. Take the cap off. Checking the expiration dates on both of those. And then I'm just going to get my syringe and my needle. And then a couple alcohol swabs here. Alcohol swab off this. And alcohol swab off this one. Okay, so we're going to be drawing up half a mil of the morphine. So we're going to pull back a little air, uncap, inject in our air. We're going to pull back some air here so that we can then draw up our normal saline. So then same thing, we're going to inject that into here. Pull back to 8. Okay, and then we're just going to go ahead and scoop that back on. Pushing out our extra air here, making sure we don't have any bubbles. Okay, perfect. Then I'm just going to once again make sure I have the right medication, I reconstituted it correctly, I have the right amount. We're going to grab a label here, which has the medication name, it has the dose, which is my 5 milligrams, the date, the time, and my initials, and we're just going to stick that right down here at the bottom of our syringe. So now the IV push medication is ready and good to go. So I'm just going to set that to the side here. I'm going to throw away. I would change my gloves before doing this now. So now I'm going to get her primary and her secondary tubing and stuff ready. So I have my IV pole here in the med room with me, and we're just going to get everything primed and ready. So I'm just going to have my primary first, which is my normal saline. It's a 250 ml bag, and it's going to be running at 75 mils an hour. So double checking my MAR here, checking my bag, opening that up. I'm going to inspect my bag, make sure that there's no holes, there's no discoloration. We're going to check the expiration date, which is 2025, so that's good to go. And then I'm going to get out my tubing here, which would also be a brand new bag, but for video purposes. And then I'm just going to inspect my tubing here. And then I'm just going to go ahead and I'm going to undo my red end. And I'm going to spike my bag. And I'm going to flip it. And give it a thumbs until it's about half full. Okay. gonna go ahead and hang that. Okay, and I'm gonna make sure my end is a little bit on the loosened so that I can prime my tubing here. And then you want to start with this upside down so that you can let this chamber fill first and then that one. So then after that, you're gonna go ahead and loosen this. Okay, we're gonna let that fill. Once that fills, you flip it, then you let your second chamber fill. You let all of your fluid run through your line until you have no air. And you're just gonna go ahead and insert that. And now this tubing line is primed and ready. Okay, move that out of the way. Now we're gonna get our secondary tubing ready. So we have our tubing bag and our medication, which is our ceftriaxone. So we're gonna look at our MAR here, and she's getting, it's a normal saline IV with 1 gram of ceftriaxone at 100 mils an hour. So it's a 15 mil bag. So it's open that all up. Once again, checking that we have the right medication, right dose, 1 gram. We're gonna check the bag, make sure there's no holes, no discoloration. Checking the expiration date, which is good to go. Open up our secondary tubing. Same thing, checking the expiration on this as well. And then making sure that it's clamped. I'm just gonna go ahead and undo this right end. Okay, hang it upside down. We're gonna give it a couple pumps. Okay, and then we're gonna hang that as well. And then we're just gonna loosen the end of this a little bit and then slowly let that run through until it's primed. Okay. And then now that medication is ready to go. They're both primed, ready to go. We'll set the pump once we get in the room. So I'm just gonna remove my gloves, do my hand hygiene. I'm gonna take my labels, my flushes, my morphine, my MAR, everything with me to my patient room. I'm gonna have new gloves on, or I'm gonna remove my gloves, do my hand hygiene. I'm gonna go to my patient room. I'm gonna knock, I'm gonna provide privacy. I'm gonna introduce myself to my patient. I'm gonna ask for her name and date of birth. So by asking for her name and date of birth, and then I'm gonna also check her band, making sure that it matches with my MAR here and that her allergies are penicillin. I'm gonna explain, Shirley, we are here to give you some morphine for your pain. I'm gonna get her pain level, so I'm gonna ask her on a scale from 0 to 10 to rate her pain for me. And then I'm gonna explain that we're gonna hook her up to her IV antibiotics and her normal saline after we give her her morphine. I would take vitals before also giving the morphine just to make sure that her respirations and her blood pressure were okay. I'm just gonna go ahead and take a look at her IV site here, make sure that it looks okay, which it does. Doesn't look to be infiltrated or anything. So then I'm gonna start with my morphine. And I need a couple flushes here. So then I would do my hand hygiene. I would put on new gloves. I'm gonna go ahead and I'm gonna alcohol swab off my tip. And then I'm gonna go ahead and I'm gonna double check my medication again so that I have my morphine, 5 milligrams. Double checking with my order, everything matches. I'm gonna have, Shirley confirm her name, date of birth. I'm gonna take off the end of this and it's gonna go into the sharps container as soon as I'm done giving this to her. I'm just gonna set that there. I'm gonna grab out my flush. The first thing I'm gonna do is I'm gonna pull back, push out that air. I'm gonna pull back for blood return, and then I'm gonna go ahead and I'm just gonna flush this site. Make sure it's patent and everything goes through, which it does. So that's garbage. Then I'm gonna go ahead and I'm gonna alcohol swab it again. And I'm gonna go ahead and I'm gonna push this morphine through, and this would get pushed over 3 to 5 minutes. So watching my watch and counting, I would go ahead and I would push this slowly all the way through. for that 3 to 5 minutes. And then I'm gonna go ahead and remove that. And then I'm gonna get another alcohol swab here. I'm just gonna swab that side. Okay. And then I'm gonna flush it. Toss this into the sharps container really quick. So now that I alcohol swabbed it, I'm gonna go ahead and flush it one more time to make sure that all of that morphine went through. So pulling back, pushing out that air. Okay, so now the morphine has been administered. I would come back 15 minutes after administering that, check her vital signs again, make sure she's doing okay after receiving that morphine. And now that she has that, we're gonna go ahead and get her ready to hook her up to her IV medications here. So what we're gonna do is we're gonna turn on the pump first. Okay, could do my hand hygiene, put on my new gloves, gonna get this all ready to go. Pop that in, enter. Okay, so first thing we're gonna do is we're gonna set up A. So we're gonna go to our A, and we're gonna look at our MAR. So that is our primary tubing, which is our normal saline, 0.9%, 250 ml bag. We would scan that, scan Miss Shirley. Checking our MAR here, normal saline, running at 75 mils an hour. So we're gonna go ahead and put in our rate, which is 75 mils an hour. And we're gonna put the volume to be infused. We're gonna not put the whole 250 so we don't run the line dry. So we're gonna go ahead and put 245. And that's gonna take about 3 hours and 16 minutes. So then after that, we're gonna go to our drug list. And you're gonna have your no drug selected, enter. Per hour. Same thing, so 75, 245, and that's gonna take 3 hours and 16 minutes. So then I could press start on this. I'm not gonna press start for video purposes, so it's not beeping. You press start on that, and then that's gonna, after I hook up the fluids, I go ahead and press start on that. And then what I will do is we're gonna hook this up first. Okay, so then I could go ahead, hit start on that, make sure that it's running properly. And then after that, I would hit stop on my machine here, and then I'm gonna hook up her secondary tubing. So now that that has been stopped, I'm gonna take my alcohol prep. I'm also gonna label my tubing right now as well, so I'm gonna go ahead and put an a green with the date, time, and my initials, and that's gonna go right up here underneath of that. Same thing. Now we're gonna alcohol swab off the end of this blue hub here. Okay. I'm just gonna unscrew that. Okay. I'm gonna go ahead and unclamp this. Attach my label onto here. Okay, so now that that is hooked up, this is hooked up. Now I'm gonna go ahead and I'm gonna go back and I'm gonna go to B. And then I'm going to check my medication as well. So I have my ceftriaxone. It's 1 gram. You'd scan your bag, you'd scan your patient. Going to check my MAR here, making sure normal saline, with IV with 1 gram of ceftriaxone at 100 mils an hour. So then I'm going to go ahead and I'm going to go to my drug list, and I'm going to page down until I find my ceftriaxone. Okay, okay. So then I grab my ceftriaxone, making sure I have the right one. Choose mils per hour. And then I'm going to go ahead and I'm going to set it for my 50 mils. Mils, all infused, 50 mils. So it's going to take my 1 hour. And then I would go ahead and hit start on that. And that's going to run my her IV antibiotics. Once that's done, then my primary tubing would take over. So now that I've done all of that, I would go ahead and check her site here, make sure that everything looks like it's running okay, which it does. Doesn't seem infiltrated. I would ask her if she has any discomfort at that site or anything. I would come back and recheck her in about 15 minutes to make sure that she doesn't have any discomfort at the site. It's not infiltrated. I'm going to reevaluate her pain. I'm going to get her vital signs again. I'm going to go ahead and remove my gloves, do hand hygiene, and then I'm going to go ahead and I'm going to document everything per facility protocol.